Secretary Clinton, Senator Sanders favors what he calls Medicare for all. Now, you said that what he is proposing would tear up Obamacare and replace it. Secretary Clinton, is it really fair to say that Bernie Sanders wants to kill Obamacare?
Well, Andrea, I am absolutely committed to universal health care. I've worked on this for a long time. People may remember that I took on the health insurance industry back in the 90s, and I didn't quit until we got the Children's Health Insurance Program that insures 8 million kids. And I certainly respect Senator Sanders' intentions. But when you're talking about health care, the details really matter, and therefore we have been raising questions about the 9 bills that he introduced over 20 years as to how they would work and what would be the impact on people's health care. He didn't like that. His campaign didn't like it either, and tonight he's come out with a new health care plan. And again, we need to get into the details, but here's what I believe. The Democratic Party in the United States worked since Harry Truman to get the Affordable Care Act passed. We finally have a path to universal health care. We've accomplished so much already. I do not want to see the Republicans repeal it, and I don't want to see us start over again with a contentious debate. I want us to defend and build on the Affordable Care Act and improve it.
Okay.
Senator Sanders?
Secretary Clinton didn't answer your question. Because what her campaign was saying, Bernie Sanders, who has fought for universal health care for my entire life, he wants to end Medicare, end Medicaid, end the Children's Health Insurance Program. That is nonsense. What a Medicare for all program does is finally provide in this country health care for every man, woman, and child as a right. Now, the truth is that Franklin Delano Roosevelt, Harry Truman, you know what they believed in? They believed that health care should be available to all of our people. I'm on the committee that wrote the Affordable Care Act. I made the Affordable Care Act, along with Jim Clyburn, a piece of legislation. I voted for it. But right now, what we have to deal with is the fact that 29 million people still have no health insurance. We are paying the highest prices in the world for prescription drugs, getting ripped off. And here's the important point. We are spending far more per person on health care than the people of any other country. My proposal, provide health care to all people, get private insurance out of health insurance, lower the cost of health care for middle-class families by $5,000. That's the vision we need to take.
Well, if I can, you know, I have to say I'm not sure whether we're talking about the plan you just introduced tonight or we're talking about the plan you introduced 9 times in the Congress. But the fact is, we have the Affordable Care Act. That is one of the greatest accomplishments of President Obama, of the Democratic Party, and of our country. And we have already seen 19 million Americans get insurance. We have seen the end of pre-existing conditions keeping people from getting insurance. We have seen women no longer paying more for our insurance than men, and we have seen young people up to the age of 26 being able to stay on their parents' policy. Now, there are things we can do to improve it, but to tear it up and start over again, pushing our country back into that kind of a contentious debate, I think is the wrong direction.
I have to talk about something that's actually working in our state.
No one is tearing this up. We're going to go forward. But what the Secretary neglected to mention, not just the 29 million still have no health insurance, that even more are underinsured with huge co-payments and deductibles. Tell me why we are spending almost 3 times more than the British, who guarantee health care to all of their people. 50% more than the French, more than the Canadians. The vision from FDR and Harry Truman was health care for all people as a right in a cost-effective way. We're not going to tear up the Affordable Care Act. I helped write it. But we are going to move on top of that to a Medicare for all system.
Andrea, I think instead of attacking one another on health care, we should be talking about the things that are actually working. In our state, we have moved to an all-payer system. with the Affordable Care Act, we now have moved all of our acute care hospitals, that driver of cost at the center, away from fee-for-service and actually to pay. We pay them based on how well they keep patients out of the hospital, how well they keep their patients. That's the future. We need to build on the Affordable Care Act, do the things that work, and reduce costs and increase access.
And that's exactly what we are able to do based on the foundation of the Affordable Care Act. What Governor O'Malley just said is one of the models that we will be looking at to make sure we do get costs down. We do limit a lot of the unnecessary costs that we still have in the system. But with all due respect, to start over again with a whole new debate is something that I think would set us back. The Republicans just voted last week to repeal the Affordable Care Act, and thank goodness President Obama vetoed it and saved Obamacare for the American people.
Senator Sanders, let me ask you this, though.
Yeah.
You've talked about Medicare for all,
Yes.
and tonight you've released a very detailed plan.
Not all that detailed, because
2 hours before the debate, you did.
Well.
But let me ask you about Vermont, because in Vermont, you tried in the state of Vermont, and Vermont walked away from this kind of idea of Medicare for all, single payer, because they concluded it would require major tax increases.
You might
and
want
by
to ask,
some estimates, it would double the budget. If you
Andrea,
couldn't sell
let me
it in
just say
Vermont,
this. Let me just say that.
how
You might
can
want to
sell
ask
it
the
to
governor
country?
of the state of Vermont why he could not do it. I'm not the governor. I'm the senator from the state of Vermont. But second of all, here is what the real point is. In terms of all of the issues you've raised, the good questions you've raised, you know what it all comes down to? Do you know why we can't do what every other country, major country on earth is doing? It's because we have a campaign finance system that is corrupt. We have super PACs. We have the pharmaceutical industry pouring hundreds of millions of dollars into campaign contributions and lobbying, and the private insurance companies as well. What this is really about is not the rational way to go forward. It's Medicare for all. It is whether we have the guts to stand up to the private insurance companies and all of their money and the pharmaceutical industry. That's what this debate should be about.
Well, as someone who has a little bit of experience standing up to the health insurance industry that spent, many millions of dollars attacking me, and probably will so again because of what I believe we can do building on the Affordable Care Act, I think it's important to point out that there are a lot of reasons we have the health care system we have today. I know how much money influences the political decision-making. That's why I'm for huge campaign finance reform. However, we started a system that had private health insurance, and even during the Affordable Care Act debate, there was an opportunity to vote for what was called the public option. In other words, people could buy into Medicare. And even when the Democrats were in charge of the Congress, we couldn't get the votes for that. So what I'm saying is really simple. This has been the fight of the Democratic Party for decades. We have the Affordable Care Act. Let's make it work. Let's take the models that states are doing. We now have driven costs down to the lowest they've been in 50 years. Now we've got to get individual costs down. That's what I'm planning to do.
Time. Hey, YouTube fans, I'm Luke Russer. Thanks for checking out our MSNBC channel. Subscribe by clicking right here and click any of the videos over here to watch the latest breaking news, mini documentaries, conversations from Shift, and other digital exclusives. Check it out.